So thank you everyone for coming today. We are here to talk about one of my absolute favorite subjects, individual access, patient access, putting the power back in the hands of the patient. Today we have Jason Sherwin with us from Clear. Health Gorilla and Clear have partnered on our individual access workflow, which we'll be talking about today. And we also have Sergio Wagner, Chief Strategy Officer at Health Gorilla. My name is Avery. I'm Executive Director of Strategy and Partnerships. And the flow today is we're going to do kind of a panel style question and answer. And then at the very end, we'll open it up to audience questions. So please, we really do encourage you to ask questions once we get to that point in the panel. So let's get started. All right. So Sergio, can you start with an answer to the question, why did we partner together? What are the synergies between Health Gorilla and Clear? Why did we take this up?
Good afternoon. When we were thinking about the TEFCA and the road ahead, obviously individual access is not only a use case, but it's a very meaningful pathway and sizable component. So as we started thinking about that piece of the equation, we wanted to partner with the absolute best in terms of identity management. And Clear gave us that with IL2 verification.
Great, thank you. Jason, can you go ahead and tell me a little bit more about why Clear is entering the healthcare market? I use you for the airport. I have you on my phone. But why is Clear entering the healthcare market?
Yeah, happy to. And first of all, thank you, Avery and Sergio and the entire Health Gorilla team for having us. We're really excited to be here. So obviously, folks associate Clear with the airport, right? And we have over 15 million users or members, as we call them, on the platform. But healthcare has always been an aspiration for Clear, and we've actually been in healthcare for quite some time, right? So in 2020, we actually built a product called Health Pass, which actually this very conference used to process, folks' vaccination records or negative COVID tests to seamlessly and securely allow consumers to, share that information to access, whether it was a conference, a sporting event, enter a bar or restaurant, for example. And so that was really a proof point for Clear that consumers are willing to share their healthcare data with Clear, right? Clear stands for privacy and security of your data, and we are a trusted brand. We've proven that in the airport. And I think, starting in the airport over 13 years ago in a highly regulated environment where we believe deeply in private-public partnerships, and we've worked with the TSA and the Department of Homeland Security for years, healthcare was a natural extension in terms of the next sort of entry point into another industry. When you think about the regulatory environment, and then most importantly, right, is your health identity as we think about it is incredibly fragmented, right? So your driver's license, your insurance card, your payment information, your allergies, your immunization records, test results, those all live in different places and in different physical locations, whether it's EMRs, your providers, your lab systems like a Quest or LabCorp, for example. And so we believe that identity can be the keys that allows a consumer to seamlessly and securely in a safe way aggregate and access all of that data into one place to process seamless experiences, whether that's accessing your health records, checking in for an appointment, and that's what excites us so deeply about the partnership with Health Gorilla, is that you guys have the access to the data. We're the consumer-facing glue that allows the consumer to verify that they are who they are, access, share, and control that record.
Yes, absolutely. Thank you, Jason. So in a few minutes, we're going to go to a view of what this workflow looks like. But before we do this, I really want to jump into the first use case that we've worked on together, and the first area that we've worked on together, launching in Puerto Rico as part of the Puerto Rico Health Information Exchange, where Health Gorilla is the technology partner to the Puerto Rico Department of Health. So, Sergio, can you tell me why it's important to have national interoperability in Puerto Rico? Why did we set up an HIE with national interoperability? Why didn't we just focus on the island?
So, can you hear me? Okay. So, first and foremost, one of the things that was actually very excited about this is that, a lot of people will get up on stage and we'll have a conversation about this, ideals and workflows and stuff. But the reality is that today we're actually having a chat and a conversation about something that's already deployed. It's working. It's happened. And when you think about the Commonwealth of Puerto Rico, right, we were lucky enough to be selected as the unifying platform. So today, we already have all 3.2 million citizens up on our aggregated, completely deduplicated, normalized data set. So when we think about that, obviously, we expanded the use case to not only call it an HIE, we actually wanted to start conceptualizing the process of an HIN, a health information network model. And in doing so, a natural evolution for that is actually giving patients access to data. So given the fact that we are a approved QHIN applicant, we wanted to start testing some of these individualized access concepts. In fact, we were on a panel yesterday with Paul Wilder and the folks from Epic. The reality is this is already happening in some small areas. I mean, I see Jim, who actually moderated our panel yesterday, right? So why is it important? It's because we wanted to use the island, we wanted to use the Commonwealth of Puerto Rico as a proof point that individual access is functioning, having a great partner to actually do it, because to Jason's point, security is paramount, right? I mean, we are talking about someone's data. And we wanted to be amongst the very first to actually not only just launch individual access with an IL2 verification using the best-in-class to do so.
Yes, absolutely. And again, one of the things that comes up for me is putting the power back in the hands of the patients, whether that citizen of Puerto Rico is in San Juan, in Miami, in New York. There's data transferability there.
Exactly. When you think about the 3.2 million Puerto Ricans, there's actually double the number of people that actually, I think the number, the last stat I saw was there's about 6.7 million Puerto Ricans, or people that would designate themselves as Puerto Rico native, that actually live outside of the island. So when you really think about the totality of flows, of ebbs and flow, that not only people that live in the island, but actually between Florida and I think New York is called the sixth borough of Puerto Rico. Exactly. It was actually very important and a key point to start by also empowering the patient, right? And when you mentioned that, as a happy, clear participant and consumer, the Puerto Rico airport just opened up, it certainly makes life a lot easier for me.
Yeah, and I think just to build on Sergio's point, I mean, Puerto Rico is a highly sort of synergistic place for us to start, right? Because to your point, Sergio, we're a New York-based company, and Puerto Rico is the sixth borough of Manhattan, or of New York City, as folks like to say. Not to mention the fact that, to your point, as we've now just launched in the San Juan airport late last year, folks can onboard with Clear in various sort of touch points throughout our network. And once you've onboarded once, you can use it anywhere, right? So if I've used it in the airport, and now I go home back to Puerto Rico from New York, and I want to access my health information, all it is for me is a selfie. No need to re-upload my government-issued document, for example, and I can seamlessly access those records. And then, let's say I travel to another location, whether it be New York or like a Miami, for example. We just announced a partnership recently with University of Miami Health. Imagine I've now accessed my records via the Puerto Rico HIE, and now I can seamlessly transmit that data and eliminate the clipboard when I present for my first visit at a University of Miami Health or another care center throughout the country.
Yes, I love the idea of eliminating the clipboard. So the next question digs a little bit more into why. And Jason, I'm actually going to start with you, but I would love to hear from both of you. Why is it important for consumers to have access to their health data?
Yeah, well, we haven't had access to it for a long time, right? So when you think about, sort of the transformation in healthcare, sort of healthcare 1.0 was paper records, right? And I think, unfortunately, in many cases that still exists. Healthcare 2.0 was, meaningful use and Obamacare and all the sort of regulations that push the electronization of health information. Healthcare 3.0 is breaking down those silos that were introduced as a function of various sort of industry factors. And so I think thanks to HHS, ONC, et cetera, the Cures Act and TEFCA, empowering consumers with access to their data is paramount, right? I, as a patient, it is my data. My wife and I just moved from New York to Boston. And not only trying to establish care is difficult unto itself, but trying to move all of our healthcare information is really, really difficult. And you end up having to fill out that same clipboard over and over again, right? And so giving me access to my data, whether it's my own data, whether it's my family member's data, whether it be my spouse or kids, et cetera, and making it really easy for me to move that data around with my consent is unbelievably powerful, right? Healthcare is a It's difficult to go to a doctor's office by itself. Why do we have to make it so difficult for you to, deal with all the administrative sort of burden, whether it be yourself or the staff, to get you into an exam room, right? We should be making it really easy for patients and consumerizing that entire experience, and that's exactly what we're focused on together.
I will add to Jason's point. I've long maintained that individual access and enabling patients to have access to their own data was always also going to be the catalyst to in some way transform healthcare. So the power is, and if I as a consumer, if I have my own access to the data, and to your point, Jason, we've seen this evolution of no access to data to a ton of data to like, I don't even know what to do with this, to how do you take the data and create one longitudinal view that actually makes sense to me as a patient, whether I want to use it for myself, whether I'm a caregiver and I want to use it for a family member. Basically, the ability to have access to your own data and empowering yourself, your family members, or whomever, it is going to transform how we think about healthcare. But it'll also transform how healthcare thinks about the consumer also. And that's a very important point, because if we're all suddenly are empowered with our own data, those visits can be transformational, I think. Now, it'll take time to get there, don't get me wrong, not rose-colored glasses, but the reality is that once this actually opens up, it's going to be like a Pandora's box. You're not going to go back. So, and I, for one, am very excited about that.
Yes to everything that you both just said, and I will also just share that I am excited about especially accessing this patient data even more securely than it's accessed today. So, for example, right now, I help my mother out caregiving for my grandmother. I just have her logins memorized. I log in and pretend to be her all the time. I manually link the records. The power of partnering with Clear and rolling this into the TEFCA model and the QHIN model is that now I can have my grandmother actually authenticate. I can prove that I'm with her, that she has given me consent to be accessing these records. That's what I'm excited about. More security and more ability for caregivers to help out family members in addition to the access to my own data. Great. So we are going to transition now into talking a little bit about what this looks like. What does it look like? So there's a few key components to individual access. There's the consenting at the point of the consumer relationship with the patient. There's the authentication, which Jason will talk to us about. And then there's the viewing of the records and kind of how we pull the records and how this fits into the QHIN framework, which Sergio will talk about. So Jason, can you tell us a little bit more about how this works in the workflow, how you authenticate yourself?
Yeah, so I guess first I'll take a step back and just talk about how we think about identity, right? So identity is a mountain, right? So Mount Everest for Clear is, for those of you who've used, Clear in the airport, I know Sergio has, and I think you have as well, Avery, right? That is an in-person TSA and Department of Homeland Security regulated, witnessed enrollment process, right? Then we think about, as we move down that mountain, we have various touch points, right? Various assurance levels to verify your identity, right? So in this case, we're doing it at an IAL2 level, which is what is required sort of through the Cures Act and TEFCA around individual access. But the point is that we can step a consumer up or down that mountain, right? Once they've met that threshold to get them through that use case. When we talk specifically about this experience, right? If I'm an existing, Clear user, right? I've used, Clear at the airport in Puerto Rico, or perhaps I've used it in New York at a Yankees game, for example, and I've just traveled back home. All I need to do in that experience is snap a selfie, verify my phone number with a one-time passcode, consent to sharing my data, right, my demographic information with Health Gorilla, and then Health Gorilla can seamlessly and securely give access to that information. If I'm brand new to Clear, no problem, right? We can seamlessly in this system, right? You're not having to go to the airport or download the Clear app to do this, right? We built we call it Powered by Clear, which is an SDK that allows you to seamlessly, in that experience, snap a selfie, upload a government-issued document such as a driver's license, and then we're able to, onboard you onto Clear for the first time, and now you're a Clear member for life, right? Of course, you obviously have the right to purge your data. That's a core tenet of Clear, is that you're always in control of your data. But once you're on, you can start to use it throughout various experiences as well. So there's not only benefit to the consumer for accessing their records, through Puerto Rico HIE, but also for various other use cases that we're building out as well.
Great, thank you, Jason. And then, Sergio, could you tell us a little bit more about how individual access works with TEFCA? Why TEFCA, cares about individual access? How are we pulling in these records, and what the opportunity is here?
Sure. So one of the things we wanted to highlight is just because of the fact that today we're actually demoing a live, not live, but a live product related to an existing application within the Commonwealth of Puerto Rico for mobile access. We wanted to fulfill the true sentiment of and guidelines, right, of TEFCA and the Cures Act, so today we're using this for the Health Gorilla app or an app. The reality is that all of this is also available eventually will be available via Firebase API, right? So it doesn't have to be the Clear app, it doesn't have to be the Health Gorilla app, it could be any app out there in the market. But specifically speaking, once you've gone through the verification and you've validated your IL2 status, we essentially use the power of Health Gorilla to use our master patient index and a record locator service, right? So we actually do a sequence search across the entire network of Puerto Rico for every single hospital, every single entity that is connected. When we actually find data, we bring it all back and we actually structure it inside of our app in a meaningful and useful way of actually reviewing and having the power of access to your own data. Data that, by the way, you can actually share back with the ecosystem or consent for other use cases if you as a consumer so choose to.
Yes, and could you speak a little bit more, Sergio, to data privacy? How are we keeping the data for the citizens of Puerto Rico safe?
Like Clear, and one of the reasons why we were so excited about this partnership, privacy is paramount. When you have to navigate this public-private model, so we at Health Gorilla are not only high trust certified, but SOC 2 compliant. We actually do all sorts of layering and security. We work with governments at a state level, at the federal level. We also have to attest to the data proficiency when we actually are doing the testing and data governance with our potential QHIN applicant approved partners such as Epic, Commonwealth, and others.
Yes, thank you. And Jason, if you could just touch on this once more, data privacy. I know you said obviously security is paramount. It's built into the nature of Clear, but could you speak specifically to data privacy as it corresponds to this workflow?
Yeah, absolutely. So privacy and security is core to everything that Clear has done and will continue to do in the future, right? So first of all, we will never sell or rent your data, right? As a Clear member, you are always in control of your data. You always have the right to purge whether it's your account in full or whether it's to unlink your data from the Puerto Rico HIE, for example. You are always in control. You are not the product, right? You are always consenting to the capture of your biometric, whether it's a selfie or whether it's your eyeballs or your fingerprints in the airport, right? And then, sorry, I just lost my train of thought. And then the way that we secure your data, right? So we're actually a qualified counterterrorism technology as a function of our relationship with the TSA and Department of Homeland Security, for example. So we maintain your data in a highly secure way. You are always in control of it. You are always consenting to share it with third-party partners, and we're always doing it in a safe and secure way.
And one more thing to add, obviously within the model of TEFCA and within the models of Clear and Health Gorilla, very much following up on Jason's point, not only when we do our record locator service, we have the ability to read consent at every level. So for instance, if we actually do a search for Sergio, and Sergio as a former Stanford executive chose to not share his data, when we actually do the read, we will see that, no data is going to come from Stanford Health because he actually opted out of data sharing. All of these things happen in real time and are part of the security and enablement that we take very, very seriously.
Thank you both. I think everybody in this room would agree data safety around health data specifically is of utmost importance. So we're going to move now to what's next. The larger kind of QHIN, individual access. It's a very hot topic right now. What kind of use cases are going to be enabled by individual access. Like let's dig in a little bit more to what you were saying, Sergio, about this really being the thing that moves healthcare in a new direction. Sergio, I would love if you could talk about some specific use cases that may be opened up with individual access.
I've always maintained that individual access is going to be the catalyst for true transformation in healthcare. And what that really means, and I'll speak to myself, right? I drink a lot of soda, but so far as I know, I don't have diabetes. That being said, I actually don't have an issue with me accessing data and or consenting for a Roche study to be done, right? So when you think about individual access and the framework of TEFCA, it actually puts the power of the data in the consumer's hands. And by doing so, it's opening up a wave of other opportunities that were previously not available in the current framework that was primarily a treatment-only version, right? So when you think about a patient accessing data or a patient having the ability to access data and have all of his or her data completely aggregated, normalized, deduped, and positioned, think about use cases for life insurance. Think about use cases for public health. Think about use cases for syndromic surveillance. It goes on, but I'll stop there.
Jason, what are your thoughts?
Yeah, I mean, I think where the power of Clear in this space, right, is we can be this single interoperable identity that allows you to connect your records, anywhere, right? So just one example would be, I talked about, for example, if I've linked my Puerto Rico HIE information through Health Gorilla, and now I can, bring that information with me to a health system in the continental United States, for example. But also think about, just as another example, I want to connect my insurance information from my health plan because I forgot my ID going into the doctor's office today, and being able to seamlessly and safely and securely verify my identity and establish a link between, as a Clear user, I'm establishing this link between my health plan and my provider. So you can imagine how this sort of web of different care centers, that whether I'm consuming them directly or whether it's where my data lives, like my health insurance or a lab or a pharmacy, et cetera, and being able to connect that identity across, right? And so what does that mean in real use cases, right? So think about check-in, right? And think about the friction that is associated with checking into a doctor's appointment, which is a heck of a lot harder than getting through TSA into an airport, right? And when you think about that clipboard and all the various things that make you in that experience, Clear can connect in partnership with a Health Gorilla, the ability to sort of access that information safely and securely and check me into that visit, right? And if you think about the day in the life of an oncology patient, right? They may go to see their oncologist, and then they may have imaging, and then they may have labs, and then they may actually have another follow-up appointment all in the same day, right? And that same patient may actually have to fill out that same clipboard 4 different times in that day because all those systems are disparate and disconnected, right? So the power of putting the data in control of the consumer is that they can, with obtained consent, seamlessly and securely share that with all their providers, completely eliminate that clipboard, and transform the patient experience entirely while also driving meaningful ROI from an administrative burden perspective.
Absolutely, and that's where I think the promise of the mission of Health Gorilla comes in. And Sergio was speaking yesterday on a panel about how the mission of Health Gorilla is really ultimately completely aligned with where TEFCA has gone. This is about national interoperability, making sure that patients' data follows the patient. And so we're really excited that, where Health Gorilla has been going, and with our partnership with Clear, we're kind of fulfilling the promise of TEFCA at the same time as fulfilling our company's missions that we've already been on the path towards. So it sounds like we have about 5 minutes left, and I do want to leave some time for questions. So before we get to questions, Sergio, what's one takeaway you have for the audience today?
That TEFCA is no longer a promise, but a reality. I mean, we haven't gotten there yet, but when you think about this, if you think about what Jason just shared, the digital clipboard is a real pain point today for healthcare organizations. So I'll also echo a fellow QHIN applicant, Paul Wilder, who said, start by starting. The reality is that there are health information networks, there are organizations that are already doing this today. We have the ability to do it today. We have the ability to operate our own health information network, and via our partnership with Clear, do a seamless IL2 verification to the highest level of security and standards, and empower individual access.
Thank you. And Jason, any final words?
You just stole what I was going to say. No, I think it's real, right? Like, this is not, we're not up here talking about the hypothetical. This is real. And there are use cases today, and obviously the qualified health information networks will take time to sort of come on board as the the disincentives start to get put in place. But in the meantime, there are real life use cases that we can deploy, whether it's under a treatment use case, for example, or others, to really put consumers in control of their data and make it as seamless as possible to consume their various healthcare experiences.
You heard it here first, folks. It's real. It's here. We're ready. We can do it today. And so with that, I will open it up to audience questions. And I believe that we have a mic floating around. So just raise your hand if you have a question.
Hi, thanks for that. I just wanted to know, in order to be able to get this access, do we have to go into the airport and sign up for Clear, or how does that work?
That's a great question, Jason.
Yes, you have to go to no, I'm kidding. You don't have to go to the airport. No, and I think I'm glad you asked that question. So take everything that you know about Clear, right, from the airport and put it aside, right? This is not a paid experience. Everything that we're describing, the demo's gone, but everything that we're describing up on the screen is free to the consumer, right? So we have various ways on your smartphone where we can proof you digitally, right? And so you're taking a selfie, and we're also running what's called liveness detection to make sure that you're a real person. So you don't need to go into the airport to consume this experience. Now, look, if you want to go into the airport, we can absolutely verify you, and that's one of the benefits of Clear is we have both these digital and these physical experiences where you can enroll for the first time. But it's an entirely digital experience, completely free to the consumer, built in a consumer-friendly and trusted way, right? So Clear has an NPS of 76, which is higher than the likes of an Amazon and a Netflix, for example. So we've cracked the code of doing this in a consumer-friendly way while also doing it safely and securely.
Any other questions from the audience? If not, then we'd love to thank you for being here today, and please swing by later. We've got other in-booth sessions. I believe we have one at 4 with Meditech, our partners that we're building a network in Canada with, and we would love to see you there. Thank you.